don't forget to click the subscribe button
and the notification bell
to see more of Dr Contessa's videos.
Good day, everyone. I am Evangeline Canlas. Normally they call me Tita Vanji. I am here now at CSA. 3 years ago, I was here because of my Frown Line treatment. Mas malalim pa siya dati, no? After 3 years now, medyo bumalik siya, pero not as deep as before. It is maybe because of my exposure to sunlight, because now I am a lady farmer, and I'm proud of it. Today, I'm going to try Dr Contessa new approach in the Frown Line treatment. Don't forget to click the subscribe button and notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up or like a returning check for one of our, of course, I could say special guests before. Let's all welcome again, Ma'am Banji. Welcome back.
Hello.
Yeah,
Hi.
I was asking Ma'am Banji a while ago, how long has it been? And it was 3 years
ago.
3 years ago. So if you recall, if you can recall, we did a procedure on this deep glabellar furrow or the deep glabellar lines. We did a combination of the filler and threads. And looking up at Ma'am Banji right now with no repeat treatments, we haven't done anything in a span of 3 years. Well, I could say it's better than before during the first time I saw her. Right, Ma'am Banji?
Right.
Yeah. So I think there's a picture of that 3 years ago before we did the procedure. It was really a long, deep, fixed line. I could say it's a deep furrow or a deepened, it's like a scarred skin already. And yeah, exactly. So Ma'am Banji was sharing that it was like for about 4 to 5 years probably that she had that before we did the procedure on or using our filler and threads, right? So somehow we are able to share with you guys that the effect is somehow it's long lasting too, because when you have those product materials inside your skin tissues, they're like helping rebuild or regenerate tissue collagen, elastin, hyaluronic, all those important tissue matrix, right? And today, we'll be doing a repeat procedure. It's making use of our threads again, but in a modified technique plus a modified thread material. So I'm again excited because we're always updating ourselves with the latest in aesthetic medicine. So, mga ka-CSA, ano kaya itong bagong method and bagong product material? So ating abangan sa pagbabalik ng CSA Medical Aesthetics. So we will be doing a mixture of our Super Skin Booster ingredients. So we have the Oriole Hyaluronic Fine or Oriole F, and then we also have our Oriole Skin Boosters. So these kinds of products, this one contain our aminopeptides, vitamins, minerals, and this one contains the hyaluronic with low molecular weight. So we wanted to mix the two to be able to help the skin regenerate, boost its collagen synthesis, help also the regeneration of our elastin, our glycosaminoglycans, and other important skin tissue matrix. So I'll open the packet of our hyaluronic fine filler. Okay, and then so this is 1 cc, and I'll get 1 cc of our Oriole Skin Booster. So I have an open one here. So I'll just aspirate it in a 3cc syringe, and we'll be mixing these components. So we call this Super Skin Booster. So it will boost the skin's regenerative capacity. So 1 cc of this. Okay, there you go. And then, so the way to mix this, so for our doctors, if you want to know how to mix this, so you have this 3-way stopcock here. So just open one side there. So it's also like the way I mix my Radies with like a saline and lidocaine if I want to hyperdilute it. So it's the same thing as this one. And then I'll just open this up and close this side here. So there you go. And then just push your hyaluronic towards your 3cc ml there, and there you go. So we're mixing already the product. So we have the hyaluronic plus the booster ingredients, your peptides or amino acids, together with your skin vitamins and minerals. And then I'll get my 1 cc of premixed hyaluronic with our skin booster, and it's ready for our injection. Back mga ka-CSA, so we're still with Ma'am Banji here. So our concern is this deep line here, the glabellar region. So in the past, we did already injection of fillers and also some of the mono PDO threads there. So today we'll be combining our Super Skin Booster and also our Octo Twist PDO threads. So a while ago, we did already cleansing of the area, plus also we numbed it with our topical lidocaine cream. So Ma'am Banji still has that straight line here. It's like a dented line there. So our goal is to elevate it and also help the skin there, stimulate your collagen synthesis, and also improve your skin tissue matrix, as well as regenerate also the skin and rejuvenate the skin, Ma'am Banji, right?
Yes.
Yan. Kasi among women, it's very important that we have a smooth skin over our forehead and in between the eyebrows. Para hindi raw tayo mukhang laging, anong sabi ng iba, Ma'am Banji? Laging galit or something like that.
Tiger look.
Yeah, the others are saying tiger look or lion look. Okay, so I have here a skin booster or Super Skin Booster preparation here. So my technique for injecting, so we already cleansed the area, so there's a betadine there. So my injection technique will be the so-called serial puncture technique, and it's gonna be very superficial, okay? So multiple injections here, okay? So when you say superficial, you create tiny blebs there. So just on the crease there, and the good thing with this filler, it has lidocaine already. That's why they said it's F+. It has a lidocaine. So when we do the serial puncture technique, it's also like a blanching technique there. And then after this, I'll combine it with my PDO Octo Twist thread. So right now, we'll be having an entry point. Before I did an entry point inferiorly, today I'll be doing an entry point superiorly. So I'll numb the entry point with my lidocaine. So a tiny injection of my lidocaine on the entry point. So here you go. And then that area, I'll make a puncture point. So my needle will be, you can use either gauge 18 or gauge 19 for this. Then perpendicularly, and I'll use a PDO Octo Twist thread. Okay, so expect some bleeding there. So this one is like a 38mm length. So we have two types, 38mm and 50mm length. Okay. So right now we're using a different kind of a PDO thread. It's already the so-called Octo Twist. So 8 strands of your PDO twisted or like coiled or intertwined in your single cannula here. So it's already loaded in your cannula, 8 strands of your PDO mono threads. Okay, you're still okay, ma'am?
Okay.
Yeah. So since my entry point is here, so towards our line, so just glide. Okay. Glide towards this straight line here. And pull it out. As easy as that. Okay. I'll be using 3 cannulas for Ma'am Banji. And there you go. Just glide towards your deep line here. So right now, actually, there has been like cases of problems with the filler injection on this glabellar line. So there were reports of necrosis and other complications. So we have already reports of filler-induced tissue necrosis or vascular accidents, or even the others already. I'm sure some of you have heard that there were filler-induced vision loss, blurring of vision. So it's hard to say blindness, okay? So for those who doesn't want to use filler in your glabellar lines, you now have an alternative type of treatment, which is the injection of your or insertions of your PDO threads. So this is now a safe kind of treatment modality for those with these kinds of problem. Like for example, this is our deep glabellar line, or for others with deep nasolabial folds or deep marionette lines. So you can now use your volumizing threads. So it's either the octo twist, or we have now the scaffold threads for these kinds of problem. So we're done with our procedure. We will show the result to Ma'am Banji when CSA Medical Aesthetics returns. And we're back, mga CSA. So we're done with our procedure. Now let's show the result to Ma'am Banji. Ma'am Banji, here's our mirror po. Yan po. So, as a review, we did a combination of the injections of our Super Skin Booster with our hyaluronic and skin nutrients, plus the injection of our Octo Twist PDO threads on the deep glabellar line, and showing the result to Ma'am Banji. And it was just a quick procedure. How many minutes? No, few minutes only. And then actually, we'll be waiting for the result of this one. We'll show the result probably like in your follow-up during the time we will be doing a brow lifting for and upper eyelid lifting for Ma'am Banji. Ma'am Banji, what's your comment po?
Yes, thank you very much, Doctora. You know, pag sa ganitong mga beauty enhancement and ano, you just go to the professionals, and that's Dr Contessa, CSA.
Touch naman ako, Ma'am Banji. Thank you so much. Yeah, it's a reminder to all of you, please do not go to those non-MDs. These are procedures that may have serious complications po, because we've been hearing non-doctors doing injections of fillers, injections of toxins, injections of even threads, okay? Yeah. So the face is, I could say, a complex structure. There are a lot of blood vessels here. So we don't want to, experience bad complications from these injections. That's why you really have to go to those certified, trained aesthetic physicians and surgeons. Okay, thank you so much, Ma'am Banji.
Thank you so much.
We'll do another procedure for her next time, and of course, we'll still check the result of this combination skin booster plus your Octo Twist PDO threads. Actually, ma'am, mga 12 weeks. That's the process for the so-called neocollagenesis, and over time, you'll still see more improvement, because 3 years ago when we did that procedure, no, ma'am, so I could still appreciate the effect of it. Okay, so sabi nga ni Ma'am Banji, pabata lang tayo ng pabata. Okay, thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.